Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program, we're going to learn a little bit more about the peace of mind packages available through our Private Services Department at the VNA. We're lucky today to have with us Lindsey Graham, who is the Private Services Team Leader. So thank you, Lindsey, for being here today.
Thank you.
I always like to start the show with viewers getting to know who you are a little bit. So if you'll tell us how long have you been with the VNA and on the Cape? And
I've been on the Cape my entire life.
Really?
Born and raised.
Very
yes.
good.
So, and with the VNA 5 years,
okay.
In many different roles, starting out initially as a nurse in the field and working in our paraprofessional department with our home health aides, and
okay.
now in the Private Services Department.
All right, so you've got a little different taste of the different versions of the VNA care that's out there.
Exactly.
Yeah. And you're a native.
Yes.
That's great.
I know.
You've seen a lot of changes.
I have, yes. Yeah, good
Over
things.
Time.
Good
yeah.
things.
Yeah.
Yep.
Now, you have a lot of different team members in the Private Services Department. Do you want to talk about their roles a little bit?
Sure. We have our Private Services Specialist, Jeanne Sarnosky, who is the kind of the point person of our department. She's the one that takes any referral calls. If you have any questions about the services or the billing, the fees, she would be somebody that you would want to talk to. We have our nurses who provide the care. We have our home health aides and homemakers who provide the care and are there to support the patients in the community. And then, of course, our schedulers who help sort of
juggle everybody.
Juggle it all and put it together.
Make it all happen, yeah.
It's a nice team of people to work with. So
Trish is probably the name that might be most familiar, or the voice that they will get at the other end of the phone if people are calling in with questions.
Yes, exactly. Jeanne Sarnosky.
Okay, I'm going to circle back just a little because I'm thinking, well, we talk about private services, and for those of us that talk about it all the time, it's a familiar term, but for the viewers that might not be familiar with private services, do you want to explain that difference a little bit?
Private services is there's a multitude of services we can provide. It is an out-of-pocket expense. However, there are some people who have long-term care insurance policies who will pay for some services.
What is that? So then it's just an individual case. People need to check with their own.
Yes, they would have to just know what policies they have and talk with them individually about what they would qualify for or what would be paid for through their long-term care.
Okay.
They would pay still out of pocket for these services initially, but we would give them all of the documentation they would need to be reimbursed.
Oh, they submit it themselves then.
Exactly.
Yeah.
Yeah.
So this would be anytime if someone is on certified care or even not, right?
Right.
So examples might be, they could be on certified care, say they're getting their insurance covering their care at home post-surgery or something, and then the insurance runs out and they say, I still would like a little help, then they could call you?
Exactly. Yep. And sometimes they have insurance care at this time and they just want more on top of it. So we can even be providing extra service even while they're getting a service covered by insurance.
Oh, okay. So it could be in addition to. Or are you ever called in for care that they haven't even had an insurance experience and it's just something that they'd use you for?
Yes. Yeah, we get a lot of calls. Just our name is well known in the community, and people just need a little extra assistance. They may never have had a relationship with us, but they hear the VNA name, and so they call up and we see what we can do for them.
They know it's a good name.
They do.
So one of the things it isn't really new because these are things that you've been doing for some time, but it's the packaging of it and talking about it. We're not always good at that. So and promoting peace of mind for people, and what kind of services might be available for that.
Well, it's interesting, as you said. These are services that we've provided for forever, and it's just that through conversation with people, we've come to know that we need to let people know that we have these different services, such as wellness calls. Some people like to just have a phone call every day, just to know that someone's checking in on them. It's a nice nice benefit to them, a nice safety.
Right. So I'm going to walk through, because I know there's a 3 sort of tiers of care and many other things above and beyond this, but one of the promotions that's out there is for the Welcome Home package.
Yes.
And maybe you can talk about that a little bit.
The Welcome Home package is geared towards people who may have gone into the hospital or may have gone into a skilled nursing facility or a nursing home, as some may hear of it.
Okay.
And maybe they don't have family, or maybe they don't have transportation to get them home. Maybe they're concerned that when they get home, things may not be in place.
Okay.
And so sometimes that keeps people from going home. It's not always an option for them. So what we'd like to do is give these people the opportunity to know that they have a safe ride home, and that when we get them home, we'll make sure that their living environment is put back together, that they have food ready to go, that their medications are organized for that night and possibly the next day, and just do whatever we need to do to make them comfortable and feel safe.
So if someone needed a pharmacy stop on the way, so say they get a ride home, okay, we'll take advantage of this. They get a ride home from the skilled nursing facility, nursing home, or the hospital, and they have to have a prescription filled on the way home or before they get home. That's something that you could do along the way that
Certainly.
This program could do.
Yes.
And
Stop
then,
even at the grocery store and pick up food
oh
too.
yeah, okay. Because oftentimes people maybe left their house in an emergent situation, didn't have time to get rid of that old milk or whatever was left behind.
Or they've been gone for months. You know,
yeah.
you never know. So just making sure that everything is put back in place and that everything is fresh and ready to go for them.
Is there a nursing visit then as part of this? Or?
There is. There would be a nurse that would come to the facility, whether it's a hospital or the nursing facility.
Okay.
And we would just talk with them about what their needs are, and then the nurse would meet them back at the home to assure that they got back safely. And it's that medication component. I think sometimes when you go into a hospital, your medications may have changed, and you may just have some questions about it, or may need some assistance organizing it for the night. So the nurse would be at the home to help with that as well.
So what the medications we're on when we go in might not be the same as what we have when we get out.
Right.
Okay.
Most of the time.
Yeah. So are there scenarios? Can you give us some like real live scenarios of how this program could be used?
Yes, I mean, if like we said, someone goes in and out of the hospital, then we can assist in that way. Another example that we could use this program is if someone has any day surgeries or.
So what would be a day surgery for viewers that might not know?
Maybe like eye surgery.
Oh, so a cataract.
Some people go in for colonoscopies or endoscopies.
Okay.
Maybe even to have something removed, like a minor skin surgery, something along those lines.
Okay.
We could, assure that they get there. We can take them there, and then we can get them home as well.
Because I think oftentimes, or as part of for the surgical end of those scenarios, when they sign up to have something done, that's part of the questioning is, you can't drive when you leave,
exactly.
So you need somebody to ride. Do you have a ride home?
Right. And oftentimes people forego these types of surgeries because they don't have the rights. So
or they don't have there's no family members nearby to take care of that, or
exactly.
Oh yeah.
So it's kind of a nice opportunity to get these surgeries done.
Right. So an eye surgery would be a good example. The colonoscopies would be good. They certainly won't be driving them. Yeah. So any of the smaller, like you said, skin surgery, something like that.
Exactly.
So anytime for the viewers that are out there that they can think of an incident where they've needed that.
Even dental.
Oh, dental,
Sometimes
right.
dental is something people don't think about, but you may need local, anesthesia, or you just need that comfort of having someone drive if you're just not feeling that well.
Right, right. So the different levels of care might change, might vary. So is there a price point on this? Is it a sort of a starting point and then it's adjusted, or?
There is sort of a starting point, and again, every circumstance is individual. So we wouldn't want to lock in at a particular, a rate, but generally it's starting around $250.
Okay.
And that would assure 4 hours of a home health aide driving you to and or from your destination or the location to home, as well as that nursing visit in the hospital and then at home.
Oh, okay.
So, but then again, anything additional that you may need, we would,
Adjust accordingly. Yeah. Yeah. So if it's that stop at the grocery store, it's a little further or takes longer than we think, or
then
there's some other.
We would talk about that,
Yeah.
and adjust it to that individual's needs.
Clean the kitty litter box, all the other things that
come up that you don't think about.
That you don't think about, right, right. So back to insurance may or may not cover some of these things, and
right.
normally.
Insurance most likely will not cover this service.
Okay.
But it's always a good idea to talk to, if you have a long-term care insurance policy, to talk to them and see what sort of options you qualify for.
Okay.
But this is it is a private service generally, so it would be an out-of-pocket expense.
All right. And back to, it's all pretty much customizable. So as far as identifying what needs people have, it's just having a conversation.
It's just a conversation. Yep, and generally, as we had mentioned before, Jeanne Sarnosky is that point person, myself as well, but Trish is sort of that person to contact who can talk with you and find out what it is that you need and help sort of develop a plan for you.
Okay. So this is not high end, but this was the bigger package of all things. Then one of the other, if we're looking at that peace of mind umbrella, the next one might be the telemonitoring.
Yes, telemonitoring is it's a nice program that if you're, as we have said in the past, throw around some of our terminology, a certified patient, or you have services that insurance would pay for.
Okay.
The telemonitor would be included, and some people really find a comfort in that. Telemonitoring is a machine that's in the home that monitors your vital signs, your blood pressure, pulse, oxygen levels, weight, and it's transmitted back to a nurse who watches that on a daily basis to assure that your well-being, is there and that you're adjusting well to any medication changes. When the nurse is discharged, a lot of people they don't want that machine to go away either. And so they do have the opportunity through the private services department to keep that. And there is a fee. It's $125 a month. And it's sort of a nice comfort or peace of mind, as we'd say, to know that a nurse is watching those vitals and that they're in communication with the doctor's offices. And if you have questions about your medications or even what your vital signs may mean that day, it's just a phone call away.
So when we talk about the vital signs, so what does it record?
Your blood pressure,
okay,
your pulse, your oxygen level, your weights. That's
heart rate.
Much it.
Heart rate. There.
Yeah.
Okay. So do you want to talk, just describe a little bit for people that maybe aren't familiar with the equipment itself? And I said, oh, we should have
I know, we should have brought one.
But it's really it's an amazing small, and it's amazing.
It's gotten much smaller. In the beginning when we started, it was a little bit larger of a tool, but it's a small machine, and it actually talks to you. It's set up to remind you. So in the morning or whenever it is that you take your blood pressure or your vitals, it will say, good morning, it's time to take your vital signs. And it prompts you. It tells you exactly what to do. So you'd put a cuff on your arm and it's all hooked up to this little machine.
Okay.
And once you're ready, it says press start and it does its thing, and then it sends all the information back to the nurse.
And then it goes on to say,
yep, put your pulse oximeter on your finger, step on the scale.
So it comes with this a little box the size of a alarm clock or radio.
Pretty much, yeah.
Yeah. That comes with the blood pressure cuff, A scale.
A scale and a pulse.
And the little pulse clip.
Clip.
And anybody can use it.
Anyone can use it.
Very simple.
Exactly. And we have nurses and technicians that when it's set up would help you. They'd give you sort of a dry run or teach you how to use it. So, and again, as we say, we're just a phone call away, so we can talk you through it over the phone as well if there was any concern.
So it seems ideal for someone that is challenged by any chronic disease or ongoing issues, even though they've been discharged from home care.
Exactly. It's a nice tool to kind of keep check on that your medications are working the way that they're supposed to be. And if you're somebody who takes a diuretic for extra fluid, and you know that the decision whether to take it or not to take it is based on what your weight says today, or what your heart or your blood pressure is doing today. It's a nice tool to have, and not only you have that, but you also have the nurse that's watching it that can kind of give you that little bit of extra reassurance or help you through that question of, you know, should I be taking it today or not?
So then what happens? So they hit a button, all these things are recorded, they're sent off to a main office, and there's someone on the other end?
There's someone on the other end.
That's keeping track of the numbers.
Exactly.
So will they automatically get a call back, or do they only get it if something looks funny? Or?
They only get a call if there's something that is beyond their norm. So if it's something abnormal for them, then they would definitely get a call.
And everybody's normal is different.
Exactly.
So that's something that's figured out ahead of time.
We watch for trends.
This seems like a great item for if people are here maybe and living alone, and their people, or kids or whatever, live off Cape and want to keep an eye on them or help keep an eye on them. Is that?
Yes, exactly.
Is that information that can be shared then with the doctor or the family? Or
it is shared as long as the client gives us permission to share it. But generally when we do sign up for this type of program, we would get permission for us to interact with the doctors. That's sort of comes with it. And then if they give us permission to send that information to family, then that's fine. It's as easy as printing it out and mailing it.
Mailing it off. Great.
So
they can hang on to that as long as they want,
yes.
right? That's quite a device.
It is.
Yeah.
Yeah.
Do they use it every day then? I mean, is it a daily transmission or 3 times a week, or is everybody different? Or?
Everyone's different, but it's nice to do daily. The rate doesn't change, so it's $125 a month, whether you use it every day or a couple times a week. And I think it's easier for us to notice trends and notice changes if you're taking it at the same time every day.
So there's some instruction ahead of time on best practice, best process.
Yes,
okay,
definitely.
All right. So then the other piece that's involved in the peace of mind umbrella would be the wellness checks that you mentioned earlier.
Those would probably be for someone that maybe doesn't need this box.
Oh, the telemonitor.
But they don't need the telemonitor, and they just want a telephone call. You know, they just want somebody to check in on them and make sure everything's going okay. And they do have access to the nursing department if they ever had questions, so they could call into us as well. But it's just nice. They know every day they're going to get a phone call, and they can look forward to that reassurance.
Is that another one of those that's at the same time every day, or it can be, or
we would probably try to do it at the same time every day, just so that they would have an idea as to when we were calling. But again, it depends on what the needs are of the client and when they would want the call.
So what would be a typical conversation in a call?
We would probably call, most of the time it's in the morning. And we would just call to see how things are going, see if they have any questions, in regards to their medications, how are you feeling today, and that's it. It can be very short and sweet, or it can be that maybe they didn't feel well the night before, or maybe they're not feeling well right now and they have some questions or concerns, and we would advise them.
Oh, so we troubleshoot a little bit with them then, based on
what's going on.
What's going on.
Yep.
Yeah.
And give them direction, either to call their doctor or or maybe it's just some advice, nursing advice.
Did you just chase the dog down the front walk and that's why you're feeling
pretty
like
much?
that?
Yes,
something like that.
Yep.
Now, what was the cost of that?
That is $30 a month.
Okay.
For a daily phone call.
So we have a good selection of price points.
Yes.
So see if I get it right, the Welcome Home package, which is ideal for someone needing a ride after a procedure of some kind, either at the hospital or they're getting discharged from the SNF or had eye surgery or something like that. They'll get a ride, home health aid services for a few hours, nurse checks with them, and that's $250.
Yes.
Give or take.
If they want to
add on to it, okay. And then the telemonitor sits in the house for a month, on it, well, or longer. Can be used daily or whatever is comfortable for the client, and that's $125.
Yes.
All right. And the wellness checks, which is a phone call, friendly phone call. Make sure you're not on the floor.
Exactly.
Something simple like that. And that's $30 a month.
Yes.
Now, when people sign up, they have to sign up for a certain period of time on any of these? Or, well, the wellness or the welcome home would probably be a
The welcome home would probably be
deal.
sort of, right. I think it would start off as that one-time event, and then maybe they would feel that they needed us on an ongoing basis. But there's no commitment ever. I mean, it's our lives change. You never know what's going to happen from one minute to the next. So, it really would be for as long as you would want it. You may try out a service and say, this was nice, but I think I could do without, or, I really like this and I want more. So it's based on the person, really, and we want our customers or our clients to feel that they have the ability to decide what's good for them, and we're happy to help them in whichever way we can.
So do you find something like the telemonitor or the wellness check phone calls, once people are signed on, they love them.
Yeah, they really
tend
do.
to stay on.
Yes.
Yeah. I think the security and
it's
the
nice
peace of
thing.
mind that it provides, right?
And they establish relationships with us as well. And I think it becomes sort of a friendly, familiar voice, that they hear, and that's reassuring in itself, just knowing that someone that is looking out for you on a daily basis.
They're connected to the outside somewhere. Yeah.
Yep.
Now, other programs, so we've touched on all the peace of mind, but there are some other, I'm thinking of things like eye drops or other difficult situations that people can get into where there isn't help available or they don't have somebody in the house. Do you do things like that?
We do. We would utilize our nurses for any of those kinds of situations. And again, it would be all unique to the person, so you can call up and ask, if we would provide that. But we do eye drops. We've done colostomy care for people who just are not comfortable, doing that for themselves. So, wound care if, they don't have the nurse coming anymore and they decide that they thought they could do it themselves but really just want a little extra help.
Oh, yeah.
We can help with that.
Oh, yeah.
So
good for people to know that the services are always available even after the insurance runs out.
Exactly.
Anything else about the private duty, private services in general? We only have about 2 minutes, so we haven't.
I think it's something that I think we always think when we're talking about private services, we're thinking about nursing and home health aid or homemaking services, but we do offer physical therapy and occupational therapy and speech therapy as well. So it's just something for people to know that we offer that.
It's just not those other services. So something like a knee replacement, and the insurance has covered a PT coming for a certain period of time, but boy, it'd be nice if she could come a couple more times. I feel a little wobbly. They could just do that to the private. And will they get the same people? Can they?
We try to provide that consistency.
Okay.
Yes, so that would be the goal because they've worked with them and they know them. And just to, as we said, that consistency is so important for people to continue, to strengthen.
Yeah, and they get familiar and they know them and like them.
Exactly.
Yeah. Anything else for private that we want to share? We covered it all.
I think we covered it.
All right.
Yes.
All right. Well, thank you so much for being here today. I appreciate your time. Hopefully the viewers have learned a little bit more about the peace of mind packages and welcome home packages that will make their lives easier as they're out there, sometimes alone. All right. So I'm Jeanne Sarnosky wishing you good health and good health care.